Tuesday, April the 19th. West Virginia's turkey season came in yesterday. I think we had a youth day on Saturday, but the weather was pretty nasty the last couple of days, and I hope a lot of people are going to get out in the woods and enjoy our spring gobbler hunting, as well as just all the incredible, just nature that the outdoors bring us in West Virginia. Believe it or not, I went yesterday morning, and believe it or not, it was freezing cold, and Jim didn't kill anything other than time, but it was time well spent. So thank y'all for allowing me to go yesterday. But we have 27 deaths since we've been together the last time. I ask again for your prayers. We've lost 6,804 people in West Virginia. The 6,778th death is a 68-year-old male from Preston County. The 6,779th death is a 55-year-old female from Harrison County. I'm sorry. The 6,779th death is a 55-year-old female from Kanawha County. The 6,780th death is an 89-year-old male from Harrison County. The 6,781st death is an 80-year-old male from Wayne County. The 6,782nd death is an 86-year-old male from Randolph County. The 6,783rd death is a 73-year-old male from Berkeley County. The 6,784th death is a 68-year-old female from Lincoln County. The 6,785th death is an 89-year-old male from Raleigh County. The 6,786th death is a 67-year-old female from Kanawha County. The 6,787th death is a 67-year-old male from Cabell County. The 6,788th death is an 81-year-old male from Putnam County. The 6,789th death is a 76-year-old male from Mercer County. The 6,790th death in West Virginia is a 51-year-old male from Berkeley County. The 6,791st death is a 73-year-old female from Kanawha County. The 6,792nd death is a 60-year-old male from Kanawha County. I want to always do this right. I want to make sure. Let me go back. The 6,791st death is a 73-year-old female from Cabell County. The 6,792nd death is a 60-year-old male from Kanawha County. The 6,793rd death is an 81-year-old male from Randolph County. The 6,794th death is an 89-year-old male from Pocahontas County. The 6,795th death is an 85-year-old female from Wetzel County. The 6,796th death is an 87-year-old male from Greenbrier County. The 6,797th death is a 75-year-old male from Hampshire County. The 6,798th death is a 93-year-old female from Clay County. The 6,799th death is an 83-year-old female from Putnam County. The 6,800th death in West Virginia is an 81-year-old female from Kanawha County. The 6,801st death is an 80-year-old female from Cabell County. The 6,802nd death is an 83-year-old male from Summers County. The 6,803rd death is a 79-year-old male from Harrison County. And the 6,804th death in West Virginia is a 78-year-old female from Tyler County. If I remember correctly in reading through those, the youngest person was 51 years old. You'll hear me tell you over and over, if you're 50 and above, the CDC has okayed you to take your second booster shot. Every single one of these is over 50 years of age. You not taking that second booster shot is a big time mistake. That's all there is to it. So all you kids, encourage them. Encourage your granddads and your dad or mom to get that second booster shot. And we need the kids vaccinated too. But we need the 50 and older absolutely to protect yourself so you don't end up on this page. The active cases in West Virginia are 466. The positive cases in the last 24 hours are 95. It's great numbers. 2.96 daily positivity rate. We must not tested very many people. 8.14 is our cumulative rate. Our recovered cases are 492,038. And get this number. We now have 88 people in West Virginia that are hospitalized. Below 100. That's really good. 22 in the ICU units and 9 on ventilators. And every county in the state's green. I've told you about your booster shots. You got to get them. As far as making progress in regard to vaccinations and everything, we're at 90.5 now on our 65 and olders. We're at 72% of our 18 and olders, and that's all good stuff. Good stuff. Jordan, hold up just 1 second. Send somebody in here. Just stop just a second. She's going crazy. All right, we're ready to go again. Baby doll was spinning and going crazy. Jordan, you tell me when you're ready.
Yes, sir. We're ready to go.
Okay. Sorry, everybody. You know, Baby Dog was in here and she was right in front of us and everything, and she was making a little racket. And I think she was playing with a toy or something like that and everything. I didn't want to distract what I was saying, you know, because this is serious stuff. You know, I want to invite you, like I've done 1,000 times, if you got any concerns, need information, go to our COVID vaccine info line. Take advantage of the free testing. Absolutely take heed to exactly this. We now only have 23 outbreaks in our long-term care facilities, and that's great. We don't have any outbreaks in our church community. We absolutely only have 13 inmate cases and 2 staff cases. A lot of people with a lot of good work right there. I encourage you about giving blood. It's really, really, really important. I encourage you about using the new vaccine calculator that was devised at WVU and Dr. Marsh and everything. It'll tell you when you need to get your shots, and it will remind you you should come to our website and use that vaccine calculator. I got to go back to this. Second booster shot. The CDC expanded the eligibility, you know, on the second booster shot to 50 and older, you know, and that you're now out, you know, the required amount of time from your last booster shot. You know, it is absolutely, I just can't tell you enough. I mean, really, really and truly, I got this. And for a couple of days, it was really, really, really bad. Naturally, for all these folks that we read all the time, they couldn't make it through it. Absolutely every name on the list today was 50 years of age and older. The youngest, 51 years old. This is open to you now. Absolutely, this hasn't gone away. You know, we hope and pray that it will make its way and be gone forever. But you've got to continue to protect yourself, because who knows when the next variant's going to come. And absolutely, we believe that with all in us, these vaccines are extremely safe. Just take time to go do this. If you're 50 and older, go get this second booster shot. Please do that. It'll protect you. It'll protect your family. You've got so much life and so much happiness in front of you. We can't lose you. You've got so much wisdom to give all the children around you. We can't lose you. We've got to have you get this booster shot. Rental assistance program for renters, for landlords, I've told you about. Take advantage. The new homeowners assistance program, it's all up on our website. It can absolutely put real bucks in your pocket. That's all there is to it, and those bucks turn into multiplier effects that make more and more goodness happen in West Virginia. The Jobs Jumpstart Program, we're going to get an update, you know, from our Director of Workforce. I promised that he'd be on today, Scott Atkins. And Scott's going to give us, you know, information about, you know, questions that were asked earlier, as well as the Jumpstart program. So, Scott, if you'll go ahead and do your thing, sir.
Good morning, Governor, and thank you for the opportunity to talk about the Job Jumpstart program. I'm going to go through some basic eligibility issues with Jumpstart, and then I'm going to fill you in on some of the metrics and some of the good things that are happening to folks who are either receiving unemployment or receiving SNAP and TANF who've now either been hired or received a credential. Under the Governor's Job Jumpstart program, West Virginia residents that meet certain criteria may receive a one-time Jumpstart payment of $1,500 for entering the workforce. Jumpstart payments will be available on a first-come, first-served basis. The program started February the 1st of this year, and it will end August the 12th of this year or until funding is expended. Just to put this in perspective, the primary purpose of Jumpstart is to get folks back in the workforce. We have employers every day. The chamber nearly every day is reaching out to workforce, looking for skilled laborers, looking for folks who have technical skills. In January, to put this in perspective, in January of 2022, according to the Bureau of Labor Statistics, or BLS, West Virginia had 50,000 job postings, 50,000 job postings. According to BLS, also in January of 22, we had 34,800 unemployed folks. That means in January of 2022, West Virginia had 1.4 jobs available for every unemployed West Virginian. And so there's plenty of jobs out there. We hear it. We see signs in every community as you travel throughout West Virginia. To give you a little different perspective, in January, we also had 14,480 folks who were receiving some sort or some form of unemployment benefit in January of 2022. That translates to 3.4 job openings for every person in January in West Virginia that was receiving unemployment benefits. So, Governor Justice, under your leadership, we came up with this program called Job Jumpstart. I'm going to go through some of the eligibility. First of all, you have to be a West Virginia resident. You can only receive one $1,500 Job Jumpstart program payment, and you have to meet one of the following. You have to have received or filed and been determined eligible for unemployment benefits on or after January 1st of 2022, or you could be receiving SNAP or TANF as of January 1st, 2022, attain a job after January 1st, work 8 weeks with an average of 32 hours per week with a West Virginia employer that's in good standing with Workforce West Virginia. Or you could be unemployed or underemployed, and underemployed is really defined as working less than an average of 32 hours per week between January 1st and August 12th, get a job, work 8 weeks, 32 hours per week. We're going to send you a check for $1,500. Or if you're unemployed or underemployed and you enroll and complete a Workforce West Virginia approved training program or approved training certification program and obtain a credential between January 1st of 2022, August 12th of 2022, and we're going to send you a $1,500 check. Let me just give you some statistics. Through April the 18th, we've had 15,226 JJP questionnaires completed, of which 13,315 are potentially eligible. Of the 13,315, 2,349 were folks who are receiving unemployment, 10,189 were folks who are receiving SNAP, and 658 were receiving TANF. The good news about the program are the folks who've already been through it, met the eligibility criteria, either received a credential or worked 8 consecutive weeks with 32 hours on average per week. We've had 37 folks who are receiving unemployment who've received a job at an average hourly rate of $17.07. We've had 50 applicants approved who are receiving SNAP that obtained employment. We have 42 folks who've already received a credential. 18 folks completed a Class A CDL training. 9 of the 18 were SNAP recipients. We've had 10 applicants complete the forklift operator certification. We've had 7 applicants complete the Microsoft specialist certification. We've had 3 folks complete the Zoom Tech certification. We've had 2 applicants complete certified nursing assistants. Both of those were SNAP recipients. And I could go on to show you and indicate how successful this program has been under the leadership of Governor Justice. So, Governor, I thank you on behalf of Workforce, allowing us to participate in a program like this to make a difference for employers, but also to get folks back to work. Now, why is that important? We talk about the unemployment rate. Governor Justice has talked about it for several months. Each of the last 6 months, we've set record lows, which is great for us. The problem that we have is that we don't have enough folks in the workforce. And so when you think about West Virginia's civilian labor force, we've averaged less than 800,000 folks since 2012. Civilian labor force includes all individuals who worked at least 1 hour for a wage or a salary, or who were self-employed during the week and including the 12th of the month. So these are numbers put together by BLS on the 12th of every month. West Virginia's civilian labor force stood at 775,600 in January of 2017. Currently, the civilian labor force is 792,300 as of March 22nd. So that's an increase of 16,700 folks. West Virginia's total employment stood at 726,200 in January 2017. Currently, West Virginia's total employment number is 753,700, an increase of 27,500. One of the issues too that we face when you think about labor force participation rate, because West Virginia is surrounded by 5 separate states, 13.1% of all the folks who are eligible to work, all eligible West Virginians to work, are working in another state. To put that in perspective, the national average is about 3.15%. So we have a lot of out migration when it comes to folks working in other states. Overall, West Virginia's labor force participation rate has increased nearly 2% since 2015, but has remained relatively static since 2019, largely because of the COVID-19 pandemic. There's also a couple other factors to consider. West Virginia's population has been declining since 2012. I don't think that's new to anyone. The state lost approximately 46,000 residents from 2012 to 22, which further decreases that population that's available to work. West Virginia's job demand has grown substantially over the past decade, from an average of 22,167 monthly job postings in 2011 to an average of over 56,000 monthly job postings in 2021. The labor force participation rate for West Virginia was 53.2% January of 2017. Today, the state's labor force participation rate is 55.0%, an increase of 1.8%. When you get granular in some of the data to figure out what age groups do we lag behind the national average, 16 to 24 is a huge group that's not working, that should be working, and folks over the age of 50. And under Governor Justice's leadership, the State Workforce Development Board has put together a strong group of leaders from the business community, from state government, from other organizations to work and strengthen West Virginia's workforce development system. So we really think that we're going to be able to improve some of those numbers, in particular with those age groups of 16 to 24. Thanks, Governor.
Thank you, Scott. Okay, everyone, I've got just a couple other things real quick. It is now, I'm proud to announce that we've declared this week as Osteopathic Physicians Week in West Virginia. You know, Tom Takubo and everything, Doc has been the leader of this band and everything to go here. Absolutely, our osteopathic, docs are doing a fabulous job across the state. We're being able to retain more here in West Virginia that are working in West Virginia. They do fabulous work. There's no question. They go through all the exact same training almost, and they offer a little bit of a different twist on different things and insight that is really solid. My family doctor is an osteopath, and that's Dr. Gary Poling. My daughter is an osteopathic doctor, as well, and that's Dr. Jill Justice, and so real believer, and so thanks Senator Katubo, and I can't ever pronounce the name, and I'm sorry, but nevertheless, a lot of really good work there, and a lot of people that we surely need to recognize. From the standpoint of our corrections officers, they have captured an escaped inmate and everything. Yesterday, there was an inmate who escaped custody while in the Taylor County Courthouse in Grafton. Officers and our Division of Corrections and law enforcement officers from Grafton and Taylor counties immediately do what we do, run to the fire. They launched an all-out search at about 1 this morning. One of our K-9 units tracked down and captured the inmate. Great work and everything. These people do phenomenal work every single day. And, it just makes me sick when people step back and and throw rocks or say bad things about these absolute heroes to all of us. And so with all of that, again, many, many thanks to what they do every day. They should be appreciated. They should be paid more. They should absolutely, without any question, be loved by everybody because they are essential to us and they do fabulous work. Last thing I've got is there's been another state record in the state of West Virginia in our fisheries and everything, but a young man caught a gigantic catfish, and he caught it right in Marmette, not very far from here in the Kanawha River, and I think his name is Cody Carver, and he's from Dry Branch, West Virginia, and if you look at that catfish, that's a blue cat. You know, that's the type of catfish that's fabulous to eat. You know, mud cats are okay, but that is a real delicacy right there. He put the fish back in the river, so maybe somebody will catch it later on in life and everything, and it'll be even bigger. It did not surpass the length from the standpoint of what the length of the state record is still a few inches longer, but it surpassed the weight, and I want to get this right. You know, the weight on this catfish was 61.28 pounds. It was 45.51 inches long. The state record for the length of a catfish of this caliber is 50.15 inches, and this fish was 45.51, but it significantly surpassed the weight. And to be perfectly honest, in looking at that baby, it looks kind of like baby dog, to tell you the truth. Baby dog's not very long, but baby dog's solid, and that was a solid fish. So Cody, way to go. Congratulations. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and I want to join the governor to thank all of the healthcare providers who are trained in osteopathic medicine for their great service to our state and our country and beyond. We continue to see some rise in the number of cases, and although the hospitalizations still are very low, as the governor communicated earlier, and the number of deaths have not risen dramatically, we are still cognizant that the COVID-19 virus will continue to infect those that are not immune, particularly the Omicron form of COVID-19 and the BA2 subvariant of the Omicron form of COVID-19 is very highly infectious. Yesterday, an important ruling by a federal judge in Florida made negative now the requirements for people to wear masks on public transit for most domestic travel. Some international travel is still impacted, but I think a lot of people are trying to figure out today how to navigate that. But at this point, and as I understand it, in planes, particularly for domestic travel and in trains, masking will be optional, and TSA will also accommodate that finding. We see that using wastewater levels and also testing levels, as well as looking at the RT value, the reproductive score for our state, that there is some additional spread of COVID-19. Again, this is not translated to hospitalizations or deaths at this point, which is great, and may well represent the level of immunity that we have based on the number of people that have been vaccinated and boosted, and importantly, the number of people who were infected with the COVID-19 virus in the late winter, early spring. We also, though, know that as we look at countries and judge the impact of COVID, that there's a metric called excess deaths. And when we look at that feature, particularly during the COVID pandemic time, there is an expectation that many excess deaths that have not been attributed to other causes may well be related to COVID. And that is an important factor to be able to compare what's going on in different countries. And the important take home, I think, for the United States is that in 2020, we were among the high performers across the world as far as the number of deaths per 100,000 people, including counting excess deaths. So it was probably related to the aggressiveness of our vaccine rollout and the fact that we immunized a number of our older citizens, like Israel did and a few other countries did. But in 2021, when we had the assets, we had the shots, we had the ability to give boosters, and now for a group of people, the governor has well articulated, those people over 50 years old who are 4 months from their last booster, they can get a fourth shot or a second booster shot, that we have been really very much underperforming in that area. And that's the reason why the governor and we are so consistently asking people to get their booster shot as they're eligible. And that's why the vaccine calculator is so good. But we have had only about 29% of our citizens get boosted. And when we look at the statistics on excess mortality in 2021, we find that if we had just stayed where we were in 2020 and we had been able to boost people the way that we initially vaccinated, we would have saved 600,000 lives in 2021. So it's really sobering when you basically realize how powerful these vaccines are. But as we've said before, the vaccines are only effective if people get vaccinated with them. So this is just another piece of information that underscores, really supports how powerful these vaccines are to save lives. And that's something that we hope that every West Virginian that's out there that's eligible will hear today and has heard. And please will go out and get their vaccinations and make sure they're up to date. Thank you very much.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Governor, that's why I quit swimming in the river. That catfish is going to swallow somebody one of these days. So our vaccine calculator continues to have great success. In less than a month, we've had over 150,000 people complete calculations with our calculator. We're going to continue to add features to that, as well as some more customization to help various groups, to include providers going forward. If you have an organization that has a site that wants to host the vaccine calculator, please reach out to us and we will work to help accommodate that. The more we make it available, the more access that people have to calculate, the better we'll be in getting and continuing to keep those numbers up. As the governor pointed out, an important milestone in that 72% of West Virginians over the age of 18 have had at least one dose of the vaccine. A couple of areas that we will continue to focus on related to data going forward to help us as testing continues to shift to more at-home testing. We'll look at other ways to use wastewater testing going forward to see how we can better protect, particularly locations that have individuals over the age of 50. So other facilities, housing areas that may be important, we'll continue to look at going forward. Also, our data related to our hospitalizations going forward is going to continue to be a key indicator for us going forward, as well as looking at outbreaks in long-term care and assisted living facilities. And happy to report that we continue to work aggressively with our long-term care facilities and assisted living facilities. And in report this morning to our task force team, Marty Wright and the team from West Virginia Healthcare Association reported that we are today at our lowest number of cases and lowest number of outbreaks in long-term care facilities in over a 2-year period. Thank you.
Thank you, sir. Secretary Bill Crouch is also joining us today and is available for questions. Dr. Ayn Amjad had a prior engagement, and she will rejoin us later in the week. We'll now go to questions from members of the media. The first today from Charles Young with West Virginia News.
Hi, this is Charles Young with WV News. Governor, are you considering any kind of incentive program to try and bolster our underperforming second booster? I know originally we gave a $100 gift card to all of the younger folks who got vaccinated in general. Are we considering something like that for older folks? Thank you.
Charles, we're talking exactly about that right now, and we don't have anything put together right yet and everything. But Charles, while you brought that up, let me just say this, and I always ask people to hear me, but I ask the media to hear me as well, and challenge people along these lines. Please do. How many people do you know? How many people do you know out there that are really had a terrible event from taking the vaccine? How many do you know? Now, you can make up stuff, but real stuff. How many do you know? And really and truly, at the end of the day, I know without question every single person that I read here is 50 years of age and older. Every single one of them is 50 years of age and older. And if you're not taking this booster shot, it is absolutely just a tremendous mistake. That's all there is to it. And we've got to quit scaring one another. I say it all along. We want to be respectful of everyone's rights. We are. I'm there 1,000%. But I also believe that I'm here to try to help educate better, to try to tell the truth over and over, to try to absolutely make it available to you only if I really believe in my heart that it's the right thing to do. So Charles, we're working on exactly what you're talking about. And maybe another incentive program would be good, because absolutely we got to stop this. We got to stop, and we can. That's the thing, is the beating thing about this whole thing. We can stop this right now, but we got to get our folks vaccinated. That's all there is to it.
All right, thanks, Charles. Next to Mark Curtis with Nexstar Media.
Good morning, Governor. Good morning, everyone. Governor, I want to go back to your ceremonial bill signing earlier today. You signed the bill to change the shape of the Veterans Council in your office. I asked because we've just had an announcement in the last week or so from the VA in Washington that there are major cuts on the way, perhaps cutting drastically 3 of the 4 VA hospitals here in West Virginia. I wonder what your concerns are about that. Are you speaking to anyone with the congressional delegation about trying to stop it? I know Secretary Diaz is on it. He's very concerned that the medical services to our veterans, and we do have the highest rate per capita of veterans in the nation. And so what are your concerns about the cuts being proposed at the VA hospitals, and what do you intend to do about it?
Okay. Mark, let me tell you just this, and you know where my heart is exactly on this. We absolutely have been in touch, and we with all of our congressional delegations folks, we absolutely have, Secretary Diaz working it, I'm working it, everybody's working. There's no way on earth that we should stand for in any way, any level of cut, considering what West Virginia has given. I mean, let's think about it. I've said it 1,000,000 times. We per capita give more than any state, period, as far as people, in our armed services, our veterans, the most of any state per capita. And so to turn to us and say, we're going to look at cutting things and cutting services in West Virginia, no, that is not going to work. That's just all there is to it. And we're going to push back with every single thing in us. And, and then if we have to turn around and, from my standpoint, and try to do things within our own state, if somebody in D.C. is silly enough to turn their back on West Virginia, it's absolutely just preposterous in my book.
All right, thanks, Mark. Next to Randy Yohe with West Virginia Public Broadcasting.
Thanks very much. I have a question for Scott Adkins. And first of all, I want to say thank you, Scott, and thank you, Governor, for answering the question I asked last week about labor force participation. I appreciate the straightforward question and straightforward answering. But Governor and Scott, there's a possibility in this special session that we may talk about creating an unemployment compensation insurance fraud unit within Workforce West Virginia. And it was talked about in Senate Bill 543. Scott, perhaps you can tell me the severity of what the problem was with fraud and what this fraud unit would do to help all of West Virginia.
Well, Randy, let me just say this. It's a nationwide problem. This fraud situation is surely a nationwide problem. But Scott, you could, if you're still with us and everything, please address that. I know that the situation is getting better. It's coming down on a federal basis. But Scott, are you still there?
Yes, sir. Randy, that's a great question. And Senate Bill 543 would codify some of the work that we're currently doing as it relates to fraud and fraud investigations at Workforce. To put it in perspective, before the pandemic, West Virginia had the fourth best improper payment rate of any state agency across the country. So we were doing very well to ensure that no one was receiving unemployment benefits that should not be receiving unemployment benefits, whether it was by fraud or by otherwise. When the pandemic hit and the CARES Act was signed into law, it created an opportunity for folks who had never received unemployment benefits in the history of our country. I'm talking about independent contractors, self-employed folks who are cutting grass with their neighbor, folks who are caring for an elderly aunt. And under the CARES Act, in the first 3 months, the federal government, USDOL, required us to pay folks benefits if they self-attested to a certain wage. So they could go to Walmart, buy a receipt book, say, hey, I made $2,000 last quarter caring for my elderly aunt. Under federal law, we were required to send out payment. Well, about 3 months into it, the Office of Inspector General got involved and said, hey, wait a minute, USDOL, that wasn't the intent of Congress. And so then they implemented a provision that required us to verify those wages, just like we normally do under a regular unemployment claim. And so the majority of the fraud that happened across the country happened in those first 3 or 4 months. We had operators from Iraq, from Russia, from China. We had bad operators right here in Kanawha County. We've been able, working with Senator Ehlenfeld up in the Northern District and Judge Thompson here in the Southern District, to prosecute some of the larger bad apples. What Senate Bill 543 will allow us to do is hire and retain law enforcement folks who have experience in paper investigations. And we're working with the county prosecutors, the County Prosecutors Institute. So what my folks will do is that they'll put a package together, deliver it with a nice ribbon on it to the county prosecutor, and we're going to go after those folks who fraudulently took unemployment benefits, $7,000, $8,000, $5,000. But to put it in perspective nationally, USDOL OIG estimates that about 11 or 12% of all federal dollars that were paid out in unemployment benefits were paid out fraudulently. Randy, I hope that answered your question.
All right, thank you, Randy. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. Governor, the inflation situation is borderline out of hand on the national level. Can you take that down to West Virginia and areas of the local economy that you are particularly worried about as we go through these inflationary times, and maybe piggyback on that a little bit with Scott? Is there a particular group of businesses in West Virginia that is particularly short on employees and really is teetering on not being able to survive without getting the people back to work? Thank you.
Well, Paul, let me tell you this. The inflation situation. We all know. I mean, I'm a guy that really tries to give everybody just the truth, fairness, a fair shot. What has the Biden administration done? I mean, they want to blame this on Putin and whatever and all that kind of stuff. And sure, we hate. I mean, it just breaks my heart in every way what's going on in Ukraine. But on day one, we just arbitrarily said, stop the Keystone Pipeline, do this, do that, everything under the sun. We have created our own mess, and it's come from DC. Energy prices are off the chart. Absolutely, from the standpoint, I mean, nobody would have ever thunk it, would they? Just imagine this. A normal grain price for a bushel of corn is $4.70 a bushel. That would be a price that farmers would delight to have. Now farmers absolutely are looking at a price that is approaching $9 a bushel. You know, from the standpoint of that, there's going to be a big margin from the standpoint of our farmers, except one thing. Everything has gone off the chart. Nobody can stop it. Fertilizers are off the chart. Diesel fuel's off the chart. The cost of equipment's off the chart. Absolutely, from the standpoint of our farmers in this nation, and that's a heck of a lot of people and everything, you know, we absolutely are facing dilemmas in every aspect. What has happened? What has happened in a matter of a little over a year? Well, the election happened. I mean, that's all there is to it. And then we started chasing these rainbows. And with all of that, look exactly where we are. I mean, for crying out loud, you've got the people of Ukraine that are really hurting. We're scared to death of Putin, of all things. America is afraid because we're weak. We absolutely should be energy independent in every way. And I don't need to be on a soapbox saying all this stuff, but I am really passionate about this. Paul, would you ever have thunk it that right outside right now it's probably 45 degrees, but this morning in Iowa City, Iowa, it was 23 degrees. Well, there's a corn crop planted in Iowa City, Iowa right now, and a good bit of it, I'm sure, planted. And there absolutely could be a bunch of that corn crop that we lose. What's going to happen to corn prices? They're already off the chart. Everything is made from corn. It'll just keep on going. And absolutely, if we don't get a grip on this from the standpoint of our federal government, you know, the old saying that my dad used to tell me all the time, don't ever expect more than you can inspect. Well, we're not inspecting anything, in my opinion, from DC today. So with all that, you know, maybe Scott, you could chime in on the labor issue that was just brought up, but you'll be better at doing that than I.
Hey, Paul, that's a really good question. We hear from employers every day. Like I said earlier, the sectors that haven't recovered really since the pandemic, hospitality, recreation, we all know about, state government. And I don't know if you've looked at the jobs that are available in state government. We have difficulty even within state government in recruiting and retaining skilled workers. I had a call last week. We had a job order put in their Putnam office from a company in St. Albans that was looking for an unskilled, unexperienced laborer. They were going to pay $30 an hour. They were looking for someone who knew how to do masonry work. They were going to start them out at $60 an hour. So, Paul, you're exactly right. Employers are desperate, driving wages up. We just have to get folks off the couch and get them into a job. I mentioned earlier that 16 to 24 age group, 30% of all graduating seniors do not have a career plan, meaning they're not going to higher ed, they're not going to community technical school, they don't have a job, they're not joining the military. So we have to, as a workforce development system, work extremely hard and work smart to get those 16 to 24-year-old, that's 30% of those high school seniors who are graduating, into a solid career plan.
All right, thank you, Paul. Next, we'll go to Jess Mancini with Ogden Newspapers.
All right, thank you for taking my question. Dr. Marsh, you talked about the 600,000 people nationwide that may have been saying that they've gotten the booster. What about in the state of West Virginia? How many people you think may have not passed away because if they had gotten a booster shot? Or thank you.
That'll be you.
Thank you, Governor. Thank you, Jess. Well, we don't have those numbers readily available to us, but I think that the important point is that we have the capabilities and we have the tools to save lives even today during the COVID-19 pandemic. And I think that one of the areas that we are very proud of is the fact that we very aggressively started to vaccinate our older citizens and all of our nursing home residents, both with first and second vaccines, first in the country, but also with boosters. And that has saved a lot of lives. And as opposed to the US, where the booster rate's about 29%, ours has been over 40%. And as we've communicated and commented on many times, we want eligible people to be continue to be very aggressive about seeking those booster doses. So we know that there have been people in West Virginia who have died, a number of them. The governor reads their names every press brief. And we know that a very large majority of those people could have been kept from dying with appropriate vaccination and boosted based on the statistics that we have nationally. But Jess, unfortunately, we don't have a specific number. We can try to see if we can calculate one. But right now, I think that the important message is the fact that if we use the boosters that we have and use the shots that we have and people choose to get vaccinated, then we will continue to see lives saved both here in West Virginia, in the United States, and across the world.
All right, thanks, Jess.
George.
Governor, I'll turn it back to you.
All right, I'm glad. Jess, I want to go back to Jess just a second. Jess, there's 6,804 people we've lost in West Virginia. Now, the booster program surely didn't start for a lot of those 6,804 people. But when it started, and I don't know exactly what that was, to now, there's hundreds, if not thousands, that we've lost. And really, it may be impossible almost to look at someone and say, we wouldn't have lost that person if we would have had if there would have been some level of vaccinated or they would have been boosted. But Jess, we got to put a percentage on it, don't we? And let's just, for the sake of putting a percentage on it, say that we've lost 2,000 people since starting to, go with the boosters. And let's say just percentage-wise, let's say we could have saved 20% of them if they would have been vaccinated. And it's probably more like 70% or 80%, but let's just say it's 20%. How many people were on the planes that hit the World Trade Centers? How many people were on those planes? Was it 400 total? I don't know exactly what it was. But the plane that went down in the field in Pennsylvania, the planes that hit the World Trade Center, the plane that hit the Pentagon, I don't know if it was 400. If we used 30%, was it 600? Jess, we can stop. We can stop the magnitude of something that would approach maybe those planes, maybe the next mine disaster, or an accumulation of all the mine disasters. We can stop it by people taking their booster shot. That's what I come here for. That's what I come here twice a week pleading with people to take their booster shots. I try to answer every single question I can answer. But Jess, we may not know exactly what the percentage is. But if we've lost 2,000 folks since we started giving all these booster shots and all that stuff, the percentage may very well be 90%. And if that be the case, we may have saved 1,800 people. If it's one, it's too many. Absolutely, Jess. I don't know. Dr. Marsh doesn't know. But we know it's significant. It's absolutely significant to all of us. We have a mine disaster and we lose 29 people. We absolutely just mourn it beyond belief. We've lost 6,804 people. And we can stop this with those booster shots. Last thing I have to say is just this. Scott Atkins, and I don't know that I got all these numbers exactly right, but I try as hard as I can to always listen to our experts. But I think he said that there's 50,000 available jobs in West Virginia today. And there's 38,000 folks that are still unemployed. We've got more jobs in West Virginia today than we do have unemployed people in West Virginia today. Now, through the Jumpstart program, we have qualified people that could go back to work, over 13,000 that are eligible, you know, that have made it through the qualifications. You know, there is no question that there's more and more and more people going back to work in West Virginia. The lowest unemployment, you know, percentage in the history of the state, 6 times in a row. That we have broken the record 6 times in a row. But let me tell you, and y'all better listen to me, you better listen to me. We need a very, very serious discussion with me and the powers to be in the legislature, and we need to get off our soapboxes, and we absolutely need to go back and revisit getting rid of the personal income tax in West Virginia. Our population is very, very, very slowly moving upward, but that would really trigger it. That's the very one that would really trigger it. We need a productive discussion. I have asked for it and asked for it and asked for it. I hope to goodness the Senate and the House hears me and hears me very well. Without any question, we can do this in West Virginia, and we can do it in a way that makes every breathing, working person in the state of West Virginia that's paying income tax put more money in their pocket tomorrow. Tomorrow. That's all there is to it. And it can be done. And it can be done properly, and it can be done quickly. You know, but we have got to have that serious discussion. The last thing I would say in regard to that, and this is all there is to it. Now, I may not be many things, but I'm a math whiz. I can do the math. But you know, it took me literally weeks and weeks and weeks to really get it, to really understand it. And that's what we've got to do. We got to bear down. For the people of West Virginia, that's what we need to be doing. And we need to be doing it right now. But nevertheless, that's all I got. I love you all. Thank